Hello everyone. Today I would like to share with you a technique that I developed that will contribute to a more precise diagnosis of a specific type of cancer, multiple myeloma. Currently, multiple myeloma is considered treatable but not curable, and the 5-year survival rate is below 50%. So how do we diagnose this type of cancer? The current approach is known as gene sequencing, which requires bone marrow aspiration, a procedure in which a needle is introduced into the hip bone to collect bone marrow. You can imagine this is very painful. The other disadvantage is that the gene sequencing will lead to possible false negatives if the puncture sites do not cover the area of cancer. So shown in the upper panel of this slide, in the bone, there's bone marrow. In the bone marrow, there are plasma cells that produce antibodies to help us fight against disease. However, if the plasma cells become cancer cells, it will overproduce a very specific type of antibody, referred to as myeloma antibody. My work focuses on a novel diagnosis of this disease, which allows us to detect this myeloma antibody in blood as a biomarker. So this is performed with an instrument in the mag lab called mass spectrometer. We only require 1 drop of blood, and therefore this is less invasive compared to bone marrow aspiration. Also, this is a 10 times more sensitive method, meaning we can monitor this cancer at a very early stage before disease progression, which cannot be detected by other methods. In addition, we monitor the blood antibody, which directly represent the myeloma cancer cell status, and therefore the false negatives can be avoided. In other words, this is a more accurate diagnosis method compared to gene sequencing. Last but not least, we can sequence the myeloma antibody for each patient. And based on the sequenced antibody for each patient, we can categorize patients into different groups. So some patients may react better to a certain medicine, while other patients or other groups react better to another medicine. In this way, we can diagnose patients more precisely and treat them with the optimal medicine. Thank you.
Thank you very much.